Here we go. And if y'all write in the chat, then we can know that you're doing good. Here we go. Oh, wait, hold on. I think it says we're live. Okay, perfect. Okay, I see us live. Excited. Okay, perfect. So yay. Okay, I can kindly see that y'all are on. Hi, my name is Lauren Peters, and I'm here with Dr. K, and we are going to be talking about the virus, but not just the virus, but ways that we can really impact our life and ways that we can build our immune system. But we are going to kick it off with questions that we've been getting about COVID and like, what is it? And this again is for educational purposes only. This event is not to replace actual care from your provider. So if you are watching and you are with Hope for Healing, you can contact one of your providers and in your portal and get an appointment. And we'll talk more about the specifics of a new appointment that we're coming out. But if you are not with Hope for Healing, you can set up a welcome call and we can talk about the specifics. So we will be talking in general, but we are not going to be talking about like the type, how much of each medication you should take or each supplement you should take. Okay, now that we have all of that, we are excited to get started. So the biggest thing I think we have a question is we see a whole lot about COVID. So what makes COVID different from other viruses?
That is a great question. When we think about COVID, when we were introduced to it in 2020, it's not that coronaviruses were new broadly to us, but SARS, where you hear the acronym SARS, it stands for Severe Acute Respiratory Syndrome. And so in a lot of Asian countries, it seemed to sequester around there, or start there, SARS-1. So some people have had that where their lungs would shut down, and then the new, COVID variant that was introduced to us and the whole human race in 2020, it was brand new to our bodies. So for certain vulnerable individuals, it's wreaked havoc. I don't know if there's any of us that don't have a family member or someone we know that has succumbed to death due to complications to it. But then in certain populations, you can have a very mild, limited illness. So, Lauren, what was the original question again?
You're good. No, I think you answered it. Is that what makes COVID different than other viruses? Is where we are, which is you've really explained a lot of the process of how it got spread and how it was new to us, and because it was new to us. So, are there any other things that make it different than other viruses?
Yeah, as far as being different, the world has known about the military and using biological warfare and all this kind of stuff. And there's some things about the virus that didn't seem to occur naturally. It's very similar to H1N1, the swine flu. There were concerns about, and this is all out there, none of this is new. It's been published and out for the world to know. So there's just things about it where it looks like it's had integrated into it things that wouldn't naturally occur. So being introduced to us, it was a brand new thing, and a lot of people developed immunity to the very first virus that went around, but as it goes around the world, it picks up different pieces of genetic material from every single person it goes into. Because viruses, the thing about viruses is they use our genetic machinery to replicate, and they stay with us.
Okay, so is that why we keep getting like new variants of COVID, and like why it just kind of seems to keep growing?
Yeah, and that's applicable to any and all viruses. It says, every year there's a new influenza strain. And so as viruses infect different people, pick up genetic material, it goes around the world, and different variants cause different types of illnesses in people. And it's just the way of viruses.
Okay. So because of that, the question I think that can come up frequently is then, will COVID or does COVID ever go away?
No, COVID will never go away. It's no longer an epidemic, but it's what we call endemic, just like the flu is endemic, meaning that it's part of us. It's been around the world. Almost all of us have been exposed to it, and it's never going away. Just like mononucleosis is never going away. It's like chickenpox is never going away. Flu is never going away.
So what is influenza then?
Yeah, so influenza is an influenza virus, and there's different types. There's A, there's B. The common cold is typically rhinovirus. And COVID wasn't the first thing that caused loss of smell. Rhinovirus would cause loss of smell.
Wow, that's crazy.
Yeah, and there's hand, foot, and mouth. They're never going away. It's
right.
just a different type of a virus. There's pox viruses, there's polio family viruses, etc.
Okay, so the question I have then is, if we believe that it is not going, well, because it's not going away, then why are there times or seasons in our life that it seems like we don't hear about it, and then all of a sudden we hear about it all the time?
Right. So there are seasonal trends, and a lot of times it depends on people being close together or cramped in close quarters. So winter and spring, when in the winter or the fall, people tend to spend more time indoors close together because it's too cold to go outside. And in Texas, it was too dang hot to go outside a lot of the summer.
Absolutely.
So that's why you see seasonal ebb and flow with certain viruses.
Okay. That makes sense. And so though we have been focusing on mainly just COVID at the beginning, because I think that's where people are concerned. I think what you said is really important, which is it's a lot like flu and mononucleosis. Those things are so a part of our normal conversation. When you're like, you have the flu, it's like, oh, okay. But because COVID was so new and we didn't understand it, I think that's why it feels like more targeted. So let's go specifically into COVID, but then I'd love to hear about flu and more information, which is, are there medications that we can have that can help us either while we have it or help prevent? And then we'll get more into nutrition and supplements.
Okay.
But,
yeah, so one little thing on COVID, and we all know this by now, but there are certain people and populations of people with certain medical problems that they're more vulnerable and what it does to the body. And so we'll talk a little bit about that in a minute. But as far as various things to support our body medication-wise, when we talk about viruses, we typically don't include antibiotics, but there is one particular antibiotic called azithromycin. It's a class of an antibiotic called macrolides. And the thing that's so unique about azithromycin is when we are sick, either from a virus or bacterial infection, azithromycin is eaten by white cells called macrophages. And when you have inflammation, your heart rate swollen, painful anywhere in your body, azithromycin is then taken in those macrophages and concentrated where there are more white cells. So be it viral or bacterial. So let's say you've got lung stuff going on. The azithromycin concentrates itself in the lungs, or where there's more inflammation, and you can use it to treat strep, which is bacterial. But as far as viruses go, one of the bacteria that likes to set up housekeeping in your mucus when you've got COVID or other respiratory viruses is Mycoplasma pneumoniae. So not only do you get the azithro being dumped into that swamp area of all those white cells where you're snotting away, and you could end up with a secondary bacterial pneumonia in addition to your viral pneumonia or viral bronchitis type of a picture. Another medication that helps a lot is nebulized, not using an inhaler, but nebulized budesonide. Now, I'm not a big fan of oral steroids because of how it suppresses the brain, but when you do inhaled steroids. It goes into the lungs where the inflammation is at. So typically we'll do budesonide twice a day, but you need to wipe your, well, we're not getting into specifics.
Right.
It's like budesonide lowers inflammation in the lungs. The other thing that now there's a huge body of medical publications, and you'll hear all kinds of things, but the FDA has now published that yes, they recognize the efficacy of ivermectin. Ivermectin won a Nobel Prize in medicine because of how excellent it is at treating parasitic infections, but it has antiviral properties. How does it work, and why is it a good idea to have on hand? It's good for other types of infections, some bacterial and parasitic, but it binds to a receptor on our cells called ACE receptors. And so the thing with coronaviruses, not just COVID, but SARS-1, that caused the horrible respiratory distress syndrome, is that it binds to the ACE receptors, and we have a whole bunch of those on our diaphragm, and it prevents spike protein, which enters our cells through the ACE receptor, multiplies, and allows COVID to have more babies and make you more sick. So it's the spike protein that makes us sick.
Oh, wow.
So it blocks that from going into our cells. And also, if there is coronavirus and some other viruses, it has those antiviral properties. And again, it's good for Lyme, Bartonella, parasitic infections too. It has some properties. It prevents those boogers from replicating, so from having babies, and so it helps you get well.
I think there's some concerns or questions and curiosities around ivermectin. And so one of the questions that came up was that there was a conception that, or a thought process that ivermectin is only for animals.
Yeah, so that's wrong. So it's been used for years in humans for various infections, and again, it won the Nobel Prize in medicine for people and parasitic infections. Just Google Nobel Prize ivermectin in medicine award. So yes, it's been used in animals for years, but there's a huge body of publications. If you go to flccc.com, first line, critical care, I can't remember what the last C in the acronym is, flccc.com, there's a huge number of publications. And those are published, they're out there, and it works amazingly well. I've taken it myself, members of my family, and we haven't had one single patient have a problem with it. We do monitor liver functions, and we practice excellent medicine. And you have to be wise and use good clinical judgment. Not all medicines are for everyone, but you want to, that's one thing that you can do to stop the spike protein from replicating. And if it does that at the ACE receptor, then hey, let's do it.
That's amazing. I think it's a really great question, though, because I think there is so much information on. So thank you so much for submitting the question. The next question that I think is really important that we kind of touched on, which is, and this is two-part, and so so the first one, are there things in medical, maybe conditions or even genetic or genomic that make people more susceptible to getting COVID and letting it turn into something called long haul COVID?
Yes, that's an excellent question. I think I would like to answer that question by defining long haul COVID. It's basically what the name says, is people who get COVID and it takes them down and they stay sick. And they kind of ebb and flow, and they're more vulnerable to getting it and other viruses again. Why is that? So everyone in our practice that has long haul COVID has a certain genetic vulnerability. And it's a genetic makeup, it's a LabCorp test, and it shows that they have an inability to drive down biotoxins in their body. So what is a biotoxin? Something, a biological organism that makes a toxin. So molds make mycotoxins. Bacteria make endotoxins and exotoxins. Venom from a snake. The venom is a biotoxin. Venom from a pufferfish. Venom from a brown recluse spider. Venom from dinoflagellates or algae. So all those things make biological toxins. And if you have that particular genetic makeup, then you are more vulnerable to developing long haul COVID. Another, as far as populations, in the first part of your question, people that have autoimmunity, people that are battling Lyme disease, Bartonella, Babesia, toxoplasmosis, anaplasmosis, ehrlichiosis, people that are former smokers, people that are obese, people who have diabetes. If your sugars are out of control, your body's inflamed, and you're more likely to get COVID and have it stick around and do more damage. Smokers are actually protected, which seems crazy and counterintuitive. Why is that? Nicotine is binding to nicotinic receptors on their diaphragm, and it protects spike protein from binding and entering the cell and replicating. So smokers are safer, but former smokers who have some lung damage and vulnerability, they're much more likely to develop problems. Right. People with kidney damage too, people with a lot of cardiovascular heart damage, and people that are already struggling with dementia or Alzheimer's because their blood the blood perfusion to their head, their vital organs is compromised. So in summary, people with autoimmunity, high sugars, former smokers, chronic infections that they're trying to get rid of, and that genetic vulnerability.
So another question that just came up, and I think this is a really good question as well, is that if it's good to have these, is it good to have something like ivermectin on hand and you could use as needed? So let's go there first.
Yeah, it really is a good idea to have that on hand, along with potentially azithromycin, budesonide. If you don't have a nebulizer, those are all prescribable. And you know, if you're a patient here, when you coordinate with your provider, we can give you the circumstances in order to know when to use it. You know, even just with exposure. I can't tell you, well, I will tell you we get at least 3 to 5 messages a week in our patient portal with a patient saying, I've got COVID, what do I do?
Right.
And we tend, or other viruses, and we've given that information maybe in various appointments, but when you are struggling with a fever and brain fog and cough and you're tired, you feel like crap, the last thing you want to be doing is opening up your patient portal and looking for the note, when did they say that? So we want to provide you with a down and dirty summary of here's what I do if I've got a virus that's giving me vomiting and diarrhea. Here's, the other thing that's a good thing to have on hand is Zofran, which is an anti-nausea medicine, or, you know, to have that available. And, you know, if I've got the runs, what do I do? And
well, and really the last thing you want to do though is when you are not feeling well, the last thing you want to do is have to run to the pharmacy too. Like,
Yes.
like how do I go get this?
Yes.
And so that is definitely one of those things.
Yeah.
I know you're about to get into a few more, but I think this is a really good question that kind of tied to something you just spoke about, which is that why some people get COVID worse than others? So it seems like I literally know someone who had COVID, didn't know they had COVID because it literally looked like low allergies. Like it was like nothing. They were sick for maybe a day, and then the person they gave it to, because they didn't know they were sick, had it for like weeks. So can you talk about that?
Yeah, that is where that person who got all the horrible symptoms had the genetic vulnerability.
Got it.
And you can be an incredibly healthy person, and I know of a family member who dropped dead, who was a long distance runner, got COVID, died in their sleep. So we don't know all of their circumstances. There may have been some vulnerabilities there, obviously.
Uncovered,
that were
right, yeah.
undiagnosed. But the other thing is, the older you are, the harder it gets. Kids can get it. They have no idea they've had it. I can't tell you how many children I have checked their antibodies. The parents will say, oh yeah, we had it, but the kids never had it. Or they had a little snotty nose and they were done. But we check and they've got big, robust antibodies to it.
Awesome.
We're like, wow. So kids get well and very rapidly, unless they've got that genetic predisposition.
Yeah.
And even if the kids in our practice have some of those genetic predispositions, they tend to do a lot better overall. Yeah.
So their comment that is technically not a question, but I do think it is a really good thing, is that after hearing a lot of this, it can be really scary. And so because of that, I think this is a really good time to talk about what we can do about it and how we can fight this. So let's go to, first and foremost, we are really, really big advocates for what you can do at home. And so let's start with, what are the things that we can do to boost our immunity at home, never stepping foot into any doctor's office? What can we do?
Well, we always talk at Hope for Healing about lifestyle modifications. So I'll say it again. You're probably sick of me saying it, but what you put into your body, what you drink and what you eat, sets the stage for your immune system. So removing inflammatory foods from your food plan and limiting refined sugar, no refined sugar if at all possible. That doesn't mean you don't get to taste yummy stuff. I mean, coconut sugar, dark chocolate, monk fruit, stevia, all those things. And so what you eat and what you drink is important. And, chicken soup, homemade chicken soup, it's got zinc and the elements from the boiled bones, and I'm just talking chicken soup. And you can put in carrots and celery and turmeric. If you like cayenne pepper, throw that in. So eating supportive foods. But when we get sick, we usually don't have much of an appetite. So it's probably a good idea to cook yourself up some homemade chicken soup.
I love that.
Get a chicken, boil it, don't cook it more than 6 hours. Just get that stock, and you've got your celery, your onions, your garlic, your cilantro, your parsley, your turmeric, your onions. You got it in there, freeze it, and then pull it out and have it available. Now, if you're not a cooking person, buy your crate of Costco sipping bone broth and have it available. Have that there. Drink enough water. You need to optimize your sleep. If you've got sleep apnea, you need to go get your sleep study and get your airway opened up, because if you don't sleep, you can't clean your brain out, and then your body is not able to heal rapidly. And when you get sick, you get full of snot and boogers, and it's like that will make it even worse. Also, remember that people who drag you down stress you out. It elicits a gut response. Your whole body doesn't function properly. So surround yourself with people that breathe life into you instead of Debbie Downers.
So good.
I don't know if there's some Dirk Downers or Derek Downers.
Maybe.
Yeah.
There may be a male or two in there.
And then movement. That doesn't mean you have to buy a gym membership, but you're just moving. You're walking. You're trying to support your immune system. You know, that's the problem. We always think, oh, I got to be perfect. I got to join a gym. No, we're not doing that.
Right.
Then stress, learning to breathe, ground, get out in nature, get sunlight early in the day, going into your eyes, take off your glasses, let sunlight hit your retinas 15 minutes a day. So those are lifestyle things that you can do at home that doesn't cost you one penny.
No, I think that's brilliant. Okay, so we talked about lifestyle. And this feels like a question that can be tied to lifestyle before we move on, is that should we wear masks? Like, will that help?
You know, that's a really good question. And over the last 3.5 years, we've accumulated a huge body of data. And unless you're wearing an N95 that you have in the hospital that has it strapped to your face, masks are not helpful. And there's a wonderful illustration of wildfire smoke and how small it is, and it penetrates N95s that people have on. You know, unless it's like the surgical grade type thing where it's plastered on your face. I see people walking around with an N95, but there's a little gap. You have been exposed to everything you're around. And for children, they've done mask studies. You rebreathe carbon dioxide. Your CO2 goes up, your oxygenation goes down, and unless you're changing it literally every time you use it, you are rebreathing garbage. They've even grown Borrelia burgdorferi out of a face mask of a child, which is the original strain of Borrelia that causes Lyme disease. So it also limits your facial exposure. So I hate masks. And so, I mean, I guess I'm pretty emphatic about that. But also, you know, it invokes fear, and fear paralyzes us. And when we start fearing, yeah, COVID is nasty, other viruses are nasty, we want to protect our bodies, but if we live in fear, we move into fight, flight, freeze, or fear. And isolation is just the worst thing. So, you know, you need to have people around, and if you get it, you don't isolate yourself. But, you know, we didn't know what we didn't know.
Right.
And we did what we thought was right, and there were people that wanted to invoke certain things, and we did what we thought was right, but now we know better.
So what you're saying is that it doesn't protect us from COVID.
Right. It doesn't.
Okay. And I feel like another reason why you particularly are so passionate about it, though, is because we also deal with a very sensitive patient population that not only is it not helpful, but it's also harmful, and especially, I mean, like, let's think our non-sensitive patients and everything, where children, and they touch masks, they share masks, and all this stuff, and then get more sick. But another thing is, like, we do children with autism, and how damaging that can be for them and traumatic.
Yeah, if they're not able to see facial expressions, there's already an impaired social awareness, and you use some of those facial clues to determine what another person is saying. You can express yourself with your eyes, but these children and adults need to know that they're loved and cared for, and they don't need to be in fear and be isolated. So we know a lot more now, and there's a lot published, and it's in the medical literature, so I'm not saying anything that is unscientific.
Right.
This is evidence-based.
We're really big at Hope for Healing, being a place that you can fact check us on, and having it, because we constantly go back to articles. We constantly go to articles and looking at all of the things. But we do understand that there are times that we do get sick, and that there are times that we are heading into environments that can cause us to be more susceptible of getting things. Like, I am one of those people who have SNPs that make it a lot easier for me to get sick, and so I have to be a lot more careful, which is actually why my voice sounds the way it does and why I have a drip. So can we talk about some of the therapies we have to help those who either, let's talk preventative, let's talk during, and let's talk post, because we do allow people who are sick to come into the office and get treated.
Yeah. So one of the things that we love here, and it's what helped me recover and become a functional medicine doctor. I was a doctor before, but I was greatly challenged by my own physical and mental and emotional limitations.
Absolutely.
So nutrigenomics, when you study how your body works together as a system, if you know that you don't make and absorb certain essential vitamins and minerals, you have to give those to yourself. And then if you have that long COVID, or what we call a biotoxin susceptibility, you need to support yourself regularly. And so if you're starting to feel under the weather, you can do, like, we have different types of IV drips, and if you're a patient here, we tailor it to what we know about you and your concurrent illnesses and things like that. Lauren, do you care to share? Yeah. Lauren has Lyme disease, and so when you have vector-borne illness, a vector is something that transmits an infection, you are depleted of certain nutrients. Those bacteria suck certain vitamins out of you. So she needs to add certain ones in. But when you get sick, we do vitamin C, and we add other things in there that are immune boosters, sometimes some Bs, and typically when we give vitamin C, we'll go ahead and we'll give some minerals with that. We also, there's all kinds of different drips, but we have this wonderful little immunity drip. We have small drips, we have small hydration drips, and the unique touch at our clinic is, if you're a patient, we'll tailor it, but even if you're not and you want to come in for IV therapy, there's a questionnaire you fill out, and we'll ask you a few questions and provide you with options.
Absolutely.
And that's kind of the difference between walking in and going, I'll take that. We look at your medical history and we know a little bit about you because we don't want to harm you.
Absolutely.
We only want to help you. All right, so immunity drips, vitamin C, we also have some supportive drips, and then we also, functional therapy-wise, and we do this for folks that develop COVID and some other viruses, but we know that one of the things that happens in our blood vessels is our immune cells get very sticky. The spike protein that sticks out of cells causes cells to stick to each other. That's why there's a higher rate of heart complications and stroke and lung and kidney complications when people develop the virus, in addition to some other things. So our red blood cells stick together. It's called roulette formation. So we know that one IV ozone therapy followed by an antioxidant drip, meaning we throw in vitamin C and a few other goodies, will cause the red blood cells to come apart. We actually have a publication showing that. So that's what we use for a lot of our adults and children that have brain inflammation called PANS, or autoimmune encephalitis of the basal ganglia. We'll just put that in their chart. We'll have a standing order, one ozone and IV therapy. You do them together. You have to do them together so that your reaction to all the bugs dying is not exaggerated and you recover faster. The other is using ear and nasal insufflation. And
I brought that over.
Yeah.
And Christopher, you may have to change the camera to get us to see it, because I can't tell what is in it.
So basically, y'all, this is an ozone generator, and the ozone is attached to it. we
don't know that we
plug
can
it
plug it
in and we turn the oxygen on, and I turn the ozone generator on, and it produces ozone gas. So what we do is we put the syringe right here, pull it up, and then we put it in the ear 3 times on, 3 on each side. And then for nasal insufflation, you hold your breath, you breathe in, hold your breath, and then I would put the syringe in this nostril, slowly put it in. She'll clog that side too, hold it for 10 seconds, then breathe out through her mouth. And so it's just this syringe, and we put it in there, and we do that with the little ones for...
That was what I was just about to ask.
Yeah,
What
yeah.
ages can you do insulation with?
Birth. Yeah. So, I mean, we haven't done any right at birth, but we have found babies that have fluid in their ears. So for middle ear infections, which looks 80% of ear infections are viral. And but if we see pus behind the eardrum, if we see fluid, we'll go ahead and put it in the ears.
I think that's what I love so much about ozone, about insufflation specifically. Oops, sorry. About insufflation specifically is because you can do it at such a young age where like ozone therapy is a little bit more invasive, or IV ozone, that you really can start to get it at a young age. So I know that there's something special though about nose insufflation is they have to be able to hold their breath, right?
Yes. So I typically around 4 to 6 years of age, we can practice if we need to, but if a kiddo has learned to go hold their breath at the swimming pool, then go under the water and blow bubbles, or hold their breath underwater, then we can usually do nasal ozone. But we practice with them and give them the opportunity. And a lot of times if mom or dad does it, then the kiddo will do it. And we use just different concentrations for different ages. When I first started doing this, the coolest thing happened. I saw a little boy who had high fever. He was, I think, about 18 months old. The parents had never used antibiotics. We'd seen him since birth. He'd been a healthy kid, which is, woo, healthy kid. But he got a nasty ear infection between Christmas and New Year's. So it was the week between Christmas and New Year's. I gave him, he had pus behind his ears and a high fever. So, we talk about all the options, shot of antibiotic, oral antibiotics, or shall we try some ozone with it and see what happens, or whatever. So we just used ozone for 5 treatments. So starting on a Tuesday, ozone every day in his ears here in the clinic, and then the following Monday was New Year's, and then I saw him on a Tuesday. We gave the 5th treatment. I looked at his ears, no fluid behind the eardrums that I could see, no pus, completely normal, and it was ozone ear insufflation. So as a pediatrician who's prescribed thousands of prescriptions of antibiotics through the years, to have a tool in the arsenal that didn't involve screwing up the gut and having to use a probiotic for 3 months or whatever,
right?
I just love ozone.
Absolutely.
Yes.
So another question we have coming up is that when it comes to IV therapy, and this is just something that I'm adding in right now that I think is really important, is my least favorite part, I think, about getting sick is the lack of focus and like brain fog that can come. And what you talked about in the drip is that I have vitamin C and stuff, but I also have something, is it taurine?
Yes.
Okay, so can you talk about the other things we can add into our drips that aren't just like, yes, so I really want us to have vitamin C and I want us to kill it, but there are so many side effects that last so much longer.
Right. So when you're sick and you have an IV drip, this is kind of where we tailor it, is taurine is called a methyl donor. And when you're sick, you want to be sure, especially if you can't take oral supplements and those kind of things, you want to give your body what you need to be able to get well faster. So the process of methylation is you provide yourself with vitamin B9. And vitamin B9 helps make dopamine, but methylfolate, vitamin B9, helps our body with detoxification and helping our mitochondria function better. So if we can put a little bit of that in the drip, we add biotin, we add L-lysine. L-lysine is a substance that is antiviral, and so we can put a little bit of that in the drip. Carnitine helps our mitochondria function. So if you're just like, you can't think, the last thing you want to do is pour through your notes when you're sick. What did she say about that? Blah, blah, blah. So when we put it in the drip, you're giving your body what you're using more of and you're becoming depleted in, and then you can get better quicker. So we do all the B vitamins like thiamine, riboflavin, biotin, pantothenic acid, B12, methylfolate. We have CoQ10 shots. We have something called a lipovitality shot, which is like it helps with weight loss, but even for people who aren't trying to lose weight, it's just a multivitamin shot, and it's awesome. It helps me clean house or have more energy. I had one this morning. Thank you very much.
And I will be having one after this.
Yes, lipovitality. Glutathione. Glutathione is the body's master antioxidant, and it lowers something in our body called tumor necrosis factor alpha. TNF alpha goes up when you're sick, and you want to pull that down, and so we can give you a little bit of glut in there too. And I really think that's what sets us aside. We know from our little questionnaire, we know from your medical history, we're tailoring what goes into that drip just for you. And again, if you just come for IV therapy, we can still help and tailor based on what you put on your questionnaire.
Absolutely. Another great question that just came up, which is a brilliant question, which is, can't I just take these in supplements, or what makes an IV different?
Yeah, that's a great question because, depending on the condition of your gut, what you have eaten or not eaten, we don't know how much you absorb. The better your gut function and health is, the more you absorb. But when you receive IV therapy, you're mainlining it. 100% of what you put in is to be absorbed. Now, I will say this, is if you saturate all the receptors, you might have smelly pee. Because the B vitamins have a funny smell to them. But the difference is bioavailability, meaning that what you put in is absorbed, and you can feel so much faster. And if you're already compromised or feeling poorly, then that IV, you may feel nauseated and not be able to take anything orally. So if you can get it through the IV, then it's a slam dunk. Now, we also have a couple of tools in our arsenal, like for kids. Well, we have a topical rapid numbing gel here called LET. It's lidocaine, epinephrine, tetracaine. We also have something called Buzzy, which is like this little ladybug thing. But when you have, people hate needles, okay? Some people do great, others don't. So if we can involve the immune system by putting Buzzy above where we're putting the IV in, once we go through, then Buzzy impairs any pain signals that come from the arm below where Buzzy's at. And we also have an ultrasound machine to guide us. And all 3 of our current nurses are trained in using the ultrasound machine. So it's a really awesome tool to have, especially, to try to find good blood vessels.
And I only say this because I think personal story is very important and vital in this. So we had one come in, and I was coming in, I was like, oh, this would be a really great opportunity, first and foremost, to show I have been having this conversation in a very relaxed environment and not feeling any pain or anything weird. So 1, we wanted to show that. But 2, I also think when it comes to taking medication, especially when you are already feeling under the weather or not feeling well, one, like my favorite I always go to is my magnesium. I feel it within my body almost instantaneously, which brings me a clarity of mind to be able to take these next steps. And so the IV therapy is really great to provide relief. I mean, I hate to say it, maybe not for everybody, but for me, instantaneous relief. Like I do have this. I will say, because they are super kind and our nurses know, is that some of them, oh, it's a little bit earlier, all good. But one of the things is the instantaneous relief that I feel, but some of them will make you feel a little like relaxed, and they hold those off, but nothing that for me at least has ever really impaired my driving or anything. It just makes me feel very chill. We call it dripsy in the office because it relaxes your body, like to feel fun. But anyway, other than that, one of the things that, and I, again, not a sales pitch as much as just want to brag on our amazing IV staff that takes care. And then one of the things that I really shocked me was the first time I had ever gotten a drip, I also got a phone call being like, okay, so how do you feel? What is going on? Did you have any reactions? And the same thing happens with ozone. So know that you're in really good, not only well-educated hands, but also with hearts that really care about our patients. So I just had to say that because I think they're phenomenal. So anyway, another question that we have going, yes, sorry, just to answer your question is yes, this is being recorded and you should be able to play back in live because this will be landed here. So even though you're just now joining us, you're welcome to continue watching at whatever place that you are currently joining us from. But a question, actually it's a statement because you kind of alluded to this. So I'm really, really excited about this, is that most of the time we get sick and then we have to hurry up and muster up the energy to remember, wait, what am I supposed to take? Okay, I need to send so-and-so to the pharmacy. That person gets sick and now we're running all around. So we have created a appointment that is just for, that is currently just for our members because we know your medical history and we need to know that. But it is called the Viral Illness Preparedness. Dr. K, can you talk a little bit about what that appointment's going to be like?
Yes. So we are creating a virtual 15-minute appointment to address any potential kind of virus, meaning, influenza, COVID, Epstein-Barr virus, hand, foot, and mouth, a reactivation of shingles, which was from varicella zoster, so that you could have a 15-minute appointment to get the things that you need if you're a patient with us. And those will be available to start on this coming Monday, the 23rd. And for children and parents, there's some other nitty-gritty stuff. I don't know all the details, but we're going to have a children's and an adult's. And then what I think you should do, because I see these messages in the portal, print your note and put it on your refrigerator. And we want to give you these prescriptions like Zofran, budesonide, azithromycin, unless you're allergic to it, ivermectin, as appropriate, in addition to cover, different supplements. And a lot of, those of you who've been with us, we've covered a lot of that, but I will say the one caveat is your kids who are, if they have a high pain tolerance, they've got pus coming out of their eyes, they've got a fever or whatever, we may ask a lot of questions through our triage system. Those of you who've talked to Michelle and our clinical staff, we're going to ask questions. But for eyes on infants and toddlers, or they're really puny, then we may ask to see them because your kids may develop, even if it's a virus that started it, they may have a secondary bacterial infection. And when this crud goes around, it could be strep also. So we want to cover all the bases and practice good medicine, but we also want to give you some tools to prepare you. Diarrhea, vomiting, recurrence of this, COVID, flu, Epstein-Barr virus. And you know us, we love a lot of our viral supplements, and we've got a brand new viral supplement that we've been using. It's unfortunately it's like 5 capsules a day for adults, but man, it works, and it's got 4 things in it.
Yes.
But we want to support you and provide that so that when you feel like crap, or your kid does, and it's all you can do to function, you've got it on your refrigerator, you purchase what you need, and you have it available.
So in particular, and this is where I love that you mentioned this, like if you are sick and you call into our office and you want an appointment and they make that decision, that is always, like, we are always going to be cautious and careful on that. But this particular appointment is really for those who want to create a system to help them prevent it. And me and Grace, which is our business director, really loved the concept of this, is because Grace is a beautiful, wonderful mother of an amazing son. So trying to remember all of that stuff and have that throughout and look through all the papers is really a lot. And And I have a chronic medical condition, and so because of that, I'm like, wait, which paper did we talk about how much vitamin D I should take? And wait, what is all of that? And then in addition to that, so that's where the whole laminating the paper. Yeah, please.
Yeah, think about when your child wakes up in the middle of the night with 102.3 and they're coughing. They've got the croup bark, or they're coughing, they look puny, they feel terrible, or they barf all over the bed. You're sleep deprived, your child's sleep deprived. I've been there and done that. I have 4 kids and now a couple of grandsons. But that's so right. So the purpose more is to prepare you when you're not sick, to have everything that you need, so you don't need to use your brain fog, inflamed mind to dig through all those previous notes. So that's the scoop. That's the story.
Yes, absolutely. So this is a great question, is if you want this appointment, you can request it in your portal. And for our patients who have the app, it should be getting in the app soon, where you can select your provider and select. And the title of this appointment, I brought this up just so I would remember, is the Viral Illness Preparedness. So we just want you to have the tools in your tool belt to be able to take that first step. And I think what Dr. K brought up is actually a brilliant point, which is that when it happens in the middle of the night, you don't want to instantly just to feel the need to go to urgent care, and you're like, okay, let me wait till the morning to figure out what's going on. You will already know what you can do, and you will have those tools. And like I told Grace, I was like, I want to have this appointment just so I can have it all in one note and then just laminate it and like stick it there to go to have. And I feel like this will be a really helpful tool for those of us who do get sick often, and especially when we know this. Another thing I wanted to point out, which Dr. K, you can talk more about this, is that when you have had your genetics done with us, that is also a tool that your provider can use. Can you talk a little bit about that?
Yeah, if you've done your genetics and you know that your body has an aggressive response, and or you can't turn off a response, we can, or if you don't have vitamin D receptors in the right amount, that your baseline vitamin D, you're going to need more than Joe Blow. And it's like, I've looked at so many tan people's blood work and their vitamin D is in the toilet. So you can't get all of it from the sun. It's all based on your genetic receptors. So just remember that with children, they can get secondary bacterial infections. So if we do need to see them, but when they're sick, but when they're well, we just want you to have the tools in your arsenal. And overall, if you can begin treatment at home, it may minimize the number of visits that you need to come in for. Mm-hmm. So like if you as an adult get COVID and you've got everything you need and you can go, boom, I'm on this, you won't need another appointment. If you don't have any long-term effects. If you're not turning the corner, you've kind of got your, okay, I'm not any better, I'm going to do this. I'm not any better, I'm going to do this. We kind of like to throw the kitchen sink at you so you can get well, and then you can back off. It's better to be very proactive because that's lost work. That's calling in sick. If you go back too early and you're run down and you're just fighting it, then you lose more work, or if it goes around your family. So we want to give you some preventative tools for your healthy family members to deal with. What was the original question?
No, you got it, which is, no, yeah, you're totally good. There we go. Because I think it is very important to do, and so I know that we're going over a little bit. So I'm going to ask one last question. But because this appointment that we're talking about is going to give you the specifics of like how much you need to take, how much your child can take, because what you're going to take as a parent is not going to be the same dosage as a child. So what we're going to do is I'm going to ask a question. I'm going to look at the clock and everything. Dr. K, rapid fire. What are supplements you can take to boost your immunity? Okay, I'm going to start the clock. Ready?
Wow.
Yeah.
Okay.
Set. Go.
Vitamin C.
Okay.
I like PRP Immune Recovery Spray or SBI Protect for the gut because it pulls your tight gap junction. It just heals the gut. Liquid D3, vitamin D3 with K2.
Absolutely.
Let me see. I like Orthomune because it's got some zinc, some D, some adaptogenic herbs. It's great. Biocidin. Okay, there you go.
Yay! Look,
All
she
right.
did it in under a minute. That's awesome. Okay, well, I think that is a wrap. Again, I'm just going to reiterate all of these things. If you are not a patient with Hope for Healing, first and foremost, we would love to get to talk to you. So I'm going to go off on a couple of things that Dr. K mentioned. First and foremost, she mentioned movement is really important. And so we have free classes, and this is for our patients and our members and non-members. So if you want to get to know more, we have free movement classes. So follow us on our Instagram profile and you can look at all the upcoming events. Next Thursday, we have a event that is really unpacking functional medicine. What is functional medicine? But we all know that functional medicine has a hard name to kind of come by because of a whole lot of different reasons, and there's a lot of misconceptions, there's a lot of myths, and there's a lot of very valid aversions to wanting functional medicine to be a part of it. And maybe you want to have more communication to talk to someone, or maybe there's somebody who's doubting your thought process on using functional medicine. We want you to be able to give them this link to be able to ask their questions as well as listen to a breakdown of what functional medicine is and isn't. Yes, what was that?
Little quick teaser on that. Functional medicine is not incense, beads, and candles.
No.
And also, we as medical providers here at Hope for Healing deal with very complex medical conditions, and a lot of people that have been given up by or just told you do this, this, and this by their allopathic medical team. We practice excellent medicine.
Right.
We strive to keep our certifications up, but we also hold ourselves to a higher standard.
Absolutely.
Because we want to be blameless in the way that we help individuals, because we come under such great scrutiny, and we have a lot more continuing medical education than I ever thought that I would be getting.
Absolutely.
But we do prescribe medicines, but
we will talk a lot more about that in the in the thing. So again,
That's right.
This was like a quick teaser. So if you want to make sure to stay tuned, so this will be next Thursday. The first part of it will be a recorded part, but we will be live in the chat, just like we're live in the chat here, to be able to communicate with you about the things that you want to hear about and questions that you have, and then we'll have a live Q&A at the end of that event. And again, if you want to, if you are a patient at Hope for Healing and you would like a viral illness preparedness appointment, so call in, and those will be schedulable starting Monday. Thank you so much for your time, and I hope you all have a wonderful day. Bye.
Yay.